Clinical Pilates Quick Tips. I'm Mary Thornton and we're going to look at hip rolls today. So this is a basic rotational movement, bringing rotation into the pelvis, the lower back, but also into the hip joints as well. So we're going to look at 3 different ranges of movement and see why you would use what movement and how it feels different within the body. So coming to lie on the back with the knees bent. And to begin with, we're just going to have the feet hip width apart. So this is the mid-range of the 2 extremes that we'll be looking at. And the arms can either be resting on the ribs, or if you have space out to your side, you can reach your arms out to the side. So we're going to slowly roll the knees from side to side, and it's a very subtle movement to begin with. What I like to think of as a tick-tock of the knees. So tick, tock, taking knees from one side to the other. Very subtle. And as we do this, bring your awareness to the back of your pelvis and notice how it feels as you roll from the left and to the right. And if it feels okay, you can gradually start to take the movement further over. But don't be in a hurry. If you're flexible, don't allow yourself just to drop your legs over to the side. You want to feel that the control is equal on the way out as on the way in. And then bring it back to centre. So that was with the feet hip width apart. Now, let's take the feet a little wider. So we're going to take the feet a good sort of shoulder width apart, if not a bit wider than that. And then, once again, we're going to subtly take the knees from side to side in a very small range of movement. Now this time, we're not only going to be getting a movement in the pelvis and the lower back, but we're also going to be getting a little bit more rotation and movement within your hip joints. So the further you go over, the more movement you're going to get within your hip joints. And once again, you move within a slow, comfortable range, equal speed through the movement, not allowing yourself just to drop into the position because you can. Don't allow that to happen. You need to control it throughout range. And then come back to centre. So now let's try in the other range. So let's bring the legs very close together so the inner thighs and the inner ankles are touching. Now this time, what happens as we take the legs over, the movement now is going to be coming more further up the body towards the lower back and trunk region. So as you take your legs further over, allow the ankles to stay together, stacked together, and feel the soles of the feet start to come off the floor slightly. And keep the legs connected as one. Once again, you're only going to go within a comfortable range for you, listening and feeling what you feel within your body. Does it feel okay? There's no need to go anywhere in particular, it's just feeling that gentle rotation in your spine within a comfortable range from side to side. And back to centre. So what we can also do, particularly with the feet hip width apart or even wider, if you want to get a bit of a side stretch, for those of you who are more advanced, taking a stretch into the side of the body sometimes feels nice. So as we roll the knees over to the right, you might want to stretch your left arm over your head, stretching through the side of the body. But just once again, make sure your legs do not collapse down. You want to feel control. And also this top buttock here, in this instance my left buttock needs to work slightly to support my pelvis. And then roll back to centre and then to the other side. So the knees are rolling over, arrive at your destination, engage the top buttock and reach the top arm away to stretch down the side of the trunk. I'll do that one more time. We're going to roll the knees slowly over to one side. Remember the feet are very wide here. We're going to stretch the top knee away from the top hip the top arm away from the trunk, stretch through the side of the body, and then roll back. Knees roll over, stretch top arm, top leg away, and roll back. So that was looking at hip roll, which is a rotational movement in the pelvis and lower back, and also the hips. So we started with the feet hip width apart. That's the mid-range of position, moving very small range of movement to begin with, and slowly checking how the pelvis feels. We can then try the feet slightly wider apart, with the feet sort of shoulder, if not wider, apart. But we can also bring the feet closer together. So it depends on where your feet are in relationship to how your spine and your hips are moving. So I hope that helps. Remember, the movement should feel comfortable. Don't push yourself into anything that feels uncomfortable. You need to check with your clinician if something doesn't feel right. So thank you for watching, and see you again soon.